Hello, my name is Enyia, doctoral student at the George Washington University Milken Institute School of Public Health. My talk is going to be centered on Black men and their health and well-being. It's entitled as a matter of policy, advancing the economic case for eliminating men's health disparities. So my outline is going to cover, by and large, how to make the economic case for advancing Black men's health disparities. You see the outline, I'm going to kind of set the context. I have 4 aims. I'm going to talk a little bit about counting the costs, making the economic case, providing some recommendations, and then closing out. So to set the stage, health, as we know, it's a matter of, or at least part of it is a matter of politics and power. And there's one particular theory that really informs the extent to which, in this context, Black men are viewed and what type of value is ascribed to Black men. So this is, again, just one conceptual framework that informs how Black men have been viewed. And so from a more practical standpoint, in terms of a particular medical condition, I want to focus on cardiovascular disease, where it's been the leading cause of death for adults in the US, with an estimated 85.6 million Americans who experience some form of cardiovascular disease. Blacks make up 13.3% of the population, but are 3 times more likely to develop CVD and twice as likely to die from CVD-related conditions than non-Hispanic whites or other ethnic groups. From an economic standpoint, this is a significant driver of health disparities in the U.S. and falls under the umbrella of social determinants of health. So the issue is that despite robust health disparities research already in place, there's a paucity of studies that have really looked at the economic impact of health disparities, specifically on behalf of the health and well-being of Black men and boys in the U.S. Across a wide range of health indicators, men report poorer health than women, and Black men have the shortest life expectancy than almost any other racial and ethnic group in the U.S. And so, again, part of this talk is going to explore and examine the economic cost of men's health disparities. I'm going to expound on the impact of racism on the heart health of Black men. I'm also going to talk about the economic case for advancing equity with respect to men's health disparities, and then also going to provide practical, equity-oriented policy level solutions that can get at trying to reduce and or eliminate men's health disparities. As far as specific numbers or costs, according to the CDC, CVD accounts for about $200 billion each year, which includes various healthcare services, meds, and lost productivity. And for example, in 2012, to put this further in context, had a racial equity lens or kind of framework been put in place, we would not have seen as much of a level of economic disparity that we are seeing. And so to kind of give a kind of further on the ground context, we can compare this to the economy of California, which is the 8th largest in the world. This is just a comparison chart looking at various costs. One is as far as the column under Levis, that is speaking to overall African Americans, and then on the right, Thorpe, he focused more so on Black men. So just kind of going down the left there, looking at excess direct medical costs, total indirect costs, total direct medical costs, total indirect costs, and total premature mortality costs. So just kind of breaking down those levels there, kind of gives you some context as to the costs. And so looking at really making the economic case, part of it is taking a root cause approach. And so we want to ensure the integration of health equity in all programs, priorities, and policies. And this is actually what President Joe Biden has begun to put in place as of this recording. And so we're looking for how that will pan out in the coming months and years ahead. We also want to provide leadership and financial and administrative support for various historically marginalized groups. So we want to evaluate and promote successful state and territorial health equity promotion practices at the national level. Also looking at the state and local level in terms of how do we better collaborate across ecosystems. We want to ensure that we engage at every level. And then also consider partnering with employers and asking them how we can leverage their resources as purchasers to ensure that diverse populations receive the highest quality healthcare by selecting health plans that offer cultural competency training for the providers and employees. These are just a few models: Anthem, Humana, Kaiser, and HealthNet. You are free to explore those models online, but just want to give some actual models that speak to this very issue. In terms of cardiovascular health recommendations, we want to look at, we want to produce more studies using direct measures of personal mediated and internalized racism. We want to identify intervening processes and structures that link racialized social structures to CVD and other health outcomes. We also want to better leverage longitudinal data sets that include a wide range of physiologic, behavioral risk factors, negative emotions, coping, resources, etc. As far as social determinants of health recommendations, we want to explore an Office of Men's Health. We want to take a transdisciplinary approach. We want to look at specific provisions in the Affordable Care Act, and also want to look at different theories and hypotheses that speak to the health and well-being of Black men and boys over the life course. That is the extent of my talk. I trust that it was informative. Feel free to reach out to me, and I look forward to answering your questions. Thank you.